So if you could catch this person on a better day, you know, you'd push here and it might be tender, but this would really hurt, and you'd be done. You know, you'd make this NTI device. And you're going to bring it back. You're not going to ask her, how are your migraines? Because you have 20 a month. You know, I'm still getting migraines. She might have had 2 in a month. Still getting them. So I don't even go there. I look at the main target. What do you like when you first wake up? That is the foundation of this entire pyramid. And the neurologic community is looking at this right here, and they're giving her Imitrex for that. She just can't, he has to cancel the parent-teacher conference. She just couldn't keep it together, and the Imitrex just didn't work. And that's what she goes to the physicians for, because no one can deal with this. Nobody. I think we can. So that's what I'm looking for. I want to decrease the base of this pyramid so that the pinnacle isn't so high. I don't care if she, well, of course I care. If she still gets headaches, it won't be like having day-ending migraines way up here. At any rate, do you ever have discomfort on the right side of your face?
Yes.
Facial symptoms, sinus on the right side more than the left?
Not sinus really, more pain right here or the back of my neck, back of my head.
Is the one side of your head more than the other?
Yes.
Which side?
I'd say my left probably is more so painful.
Your teeth ever ache or sensitive to cold?
Yes.
One side more than the other?
Yes. I mostly chew on my left side, so I would say.
So you would say,
75,
what is it?
75% of my headaches are on my left side.
I've been watching her really close when she talks. And here's her lower and upper midlines. And when she talks, her jaw's doing this all the time. It's shooting to the left all the time. So that's why I start pushing around with right-sided facial, because it's the right lateral pterygoid pulling this condyle. And then when she starts talking about headaches and all this kind of stuff, and she chews on the left, and she goes over here, and she's clenching on the left, probably really intensely more than on the right. And the lateral pterygoid, when it's advancing her condyle, the right lateral pterygoid is more tense, so it's bringing this thing forward. So I watch people, I just stare at their teeth and watch them. Finally, as a dentist, you can stare at people's teeth legitimately, not be like a weirdo. I'm thinking, if I make this NTI device, I'm going to check for left excursive, because right now I bet she can fly over there. Not today, because it'll be sore, but someday she might be able to, because right now she's always drifting to the left every time she says something. Not because there's blockage in a condylar space, not because there's a displaced disc, because the right lateral pterygoid is more tense than the left, and so the jaw tracks to the left a little bit. Can you keep your mouth open real easily when you get your teeth cleaned?
It hurts.
Do you call time out?
Yeah, well, I try not to, because you don't want to get it over with.
I got a still shot? It'd be so great. Go like this. They'll hit it the first time hard, and then tap on it. Whole thing just kicks in. How hard can you squeeze on that? Does it hurt your lower teeth to squeeze on it real hard?
Yeah.
Which teeth?
This one.
Just one. So we're going to modify the device in a little while, because if you've got one taller than the other, or the device discluding them just accidentally is a fractional millimeter and one central hits more than the other, all of the force, although it's not very much, is on one central. If you can put on 2 centrals, you've cut the force in half that tooth is feeling. Cut it in half. Boom, right now. Go like this. Forward. She's going right in front of it. Because her lateral pterygoids are really good at doing things. Go that way with your jaw. Close on it. Go that way. She's not going to get canine contact for a little while. I don't think she will. I think she's more of a protrusive, because as she's talking, her lower incisors have that sort of rolled in look, because they can barely, it almost does that as she talks. You know, they just slip right on top of each other. So she's going to be a protruder. Do that again. She goes, okay. What else do you want me to do? So that would be a beak. Probably extend that thing. Or if in advance you'd saw that this person can do that quite easily, and you might want her to wear it during the day, make it on the lower. So when she goes forward, the beak is extending distally. So when you bite down on it and squeeze, a tooth hurts. Mm-hmm. Tap on it. How bad is it squeezing on your top teeth?
Well, it's tent, yeah.
Is it bugging your top teeth?
A little bit. I mean...
Is it weird?
Yeah.
Okay, we'll agree on that. It's weird. You got a weird thing hanging onto your teeth. Does it feel like... Okay, bang on it.
It's... I mean, I can handle it, yeah.
Don't let him handle it. Don't let him handle it. Mike says, don't let him handle it. I picked that up from you. How's the pressure over there? Does it feel like a part of your head or a thing on your teeth, especially when you bang on it?
Well, it still feels like...
Okay, it's a big goofy thing in your mouth.
Uh-huh.
And now that when you deliver this and they bite down, you hear thunk, thunk instead of clack, clack, because thunk, thunk is good and clack, clack is one tooth. You can hear it when you're doing adjustment. You go, oh, I don't know how we know. Oh, that sounds right. Then you do this. You go around and you put away your stuff, and you're filling out your chart. You do the thing, and then you say, is this challenging you? Don't say, do you have too much vertical dimension? That's what I just asked her. Is this challenging you? Don't say, is your jaw too far open? Because they're going to go, they'll sit there and they'll say,
well, it's going to be challenging to talk. That's all I can, I mean, it doesn't hurt or anything.
And then you say, does it feel like your jaw's being propped open, kind of?
A little bit.
So I might decrease vertical on those. But I'm going to check and see excursive if I have room to do so. Because I don't want to, I want to subdue the giant. I don't want to piss it off. If you open it up too far, too soon, too quick, it's too disruptive. And so when they sit there and they go, well, if I had said, does it challenge you? They go, well, it's, you know, got to get used. Hard to swallow now. I say, so I'll get used to it. Then I'll say, does it feel like your jaw's being propped open? Yeah. Close it down a millimeter. But she didn't really go there, you know. So let me see. Bite on this thing again. Open up a little bit. I'll bite down and grind to the side. Go forwards and backwards. Now from there, grind to the side. When she protrudes, of course, the posteriors are getting farther apart. When she retrudes, it looks just about right. So I'm going to err to leaving it the way it is, and it's the protrusive that might need to be modified at some point.
Who knows?
You know what? The only reason I say that kind of stuff is because I had a headache every day, all day long for 12 years. So the reason I'm asking you stuff, I'm just seeing if you sound like me. Mm-hmm. The cool thing is we all sound the same. So stick around. I'm going to add to that thing when we're all done.
Thank you.
Okay. Here, I'll take that thing.